Okay, very exciting today about novel coronavirus.
Very exciting. First of all, I personally believe that the Philippines Department of Health has reacted very flat-footed on this entire situation. Simply because yesterday, the World Health Organization declared the coronavirus as an international health emergency, which is obviously a very serious situation. And basically what Department of Health has been saying the whole time during their press conferences is, no, listen to us. Don't listen to anybody on social media. We're the official channels. I tell you what, they were also the official channel, Department of Health, when they released an illegal closure order on our facility back in 2018, which we sued them for, which in November of 2019, they offered us a settlement for in court in Tarlac, which we accepted. So yeah, the official channel, they screw up. All right?
Okay, yeah. So
understand that. And, I believe, are they finally saying that folks should wear masks and wash their hands?
Well, I'm going to tell them later.
You've been telling that for a week.
I'm going to tell
you
you
later. Get with the program, Secretary Duque. Seriously. I mean, I know you're really busy right now. You're probably, busy helping your family's pharmaceutical company out, or basically leasing out more space to the Department of Health, or PhilHealth to your family's real estate holdings. But for a second, put all that aside. Put it all aside and put the Filipino people first. Just this once.
Okay, Sir Jack is empowered today. So he's empowered. But I'm going to be talking about novel coronavirus, okay? I'm here actually to teach each and every one of you and why you should not be afraid, and everyone should be relaxed. So wag mo kayo nervyos, okay? So just recently we had the first confirmed case of coronavirus in Phil, and everyone is sending me a message, Doctora, what can we do? They're all scared. So, but what is coronavirus? Novel coronavirus. So novel, it's because it's new. So that's the reason why they use novel coronavirus. So this is a new strain of coronavirus. The ones that have the same virus that caused SARS, diba? I remember in 2003, it caused also panic in Phil, diba? So I can remember I was in the hospital back then, and they're all scared. So everyone wanted to wear masks. So medyo scary siya. But
some wear masks just because they're KSP though.
But basically, it came also from China.
Yes.
So this came from China. This one, it came from Wuhan, China. So this, according to a lot of news, they say that it came from a fish market. So, but then at that fish market, they were also selling some of the wild animals. Okay, so ang nangyari ho,
and domestic animals.
Yeah, so ang nangyari was the virus jumped from one animal to another animal, and eventually it landed in
That's
a
due to
person.
mutation.
Yeah, so nagkaroon ng mutation. But they were saying it was conflicting reports back then, di ba? Sabi nila it was from civet cat. There were also reports that it came from
There were reports from bats, from cobras, from cats.
Yeah, but eventually it was isolated in bats. Okay, so from bats, nagpunta po siya sa humans. And it became very virulent. Okay, so medyo nakakatakot siya. But actually, compared to SARS has a 10% fatality rate, SARS. So out of 8,000, if that's 10%, 800 will die. But this one, okay, this new virus, based upon reports, it's actually only 2%, the fatality rate. So for
typically those who are old or immunocompromised.
Yeah, old, immunocompromised, pregnant, young children. So they are the ones that are really severely affected, okay? And if they will be affected, they would usually die because of acute respiratory syndrome, okay? Para silang nalulunod, yun ang nangyayari sa kanila. But don't be afraid. Now, the thing is, the most unique about this novel coronavirus, is that it is infectious.
During the incubation period.
During the incubation period. They were saying it's 2 days, and some as early as 1 day. 1 day to 14 days, they are infectious. So nakakatakot siya. Because some person, you can contract the disease, or you are infective. even if you don't have any signs and symptoms. So you feel great, wala akong nararamdaman, and then magugulat ka na lang, yeah, nakakahawa ka na pala. So that's the most scary about it, right?
Yeah.
Yeah, but I will tell you a lot of practical ways why you shouldn't be scared and what you can do to protect yourself. So what are the symptoms?
You're not powerless here. You're not powerless, and you don't have to be a victim of this. There's many steps again that she's going to outline, which can reduce your chance of infection, and in the event of infection, to potentially help you.
But these are viruses, okay? So when you talk about viruses, it's the same as viruses, rhinovirus, if you have common colds, okay? Magkakapareho yan, dengue, okay? Hepatitis.
Which I had dengue, and it sucked.
Okay, so these are all viral infection. So when you talk about viral infection, these are self-limiting. So self-limiting means your body has to overcome it. Kaya pag pumunta ka sa hospital, they will not give you anything. Most of the doctors, they will just prescribe you something to enhance your immune system. Like me, when I was still a practicing medical doctor in my country, when someone comes to me, they have a viral infection, we do not give antibiotics because antibiotics have no effect.
Zero.
Okay, on a viral infection. So if someone gives you an antibiotic and you have a viral infection, you have to tell them, Doc, meron akong virus, I don't have any bacteria. It does have no effect on the body. So no one should be giving you an antibiotic if you have a viral infection.
That's like if you have a flat tire in your car and someone would stop and give you an umbrella.
No, yeah.
It doesn't really help.
Okay, so the ones that would really help you is a strong immune system, okay? So that's the most important thing about all viral infection. They are, again, self-limiting. So it's very important to focus on nourishing your body. Okay, very important yan. So the symptoms, again, it can vary. So some of them, you have cough, you would have fever, okay, some they would have colds as well. And
Nasal
eventually,
discharge.
they would have difficulty of breathing. So hindi sila makahinga. Okay, so they would go to the hospital. So now, okay, baka mamaya, maybe they would have cough, fevers, and cold. And then you said, Doc, I have coronavirus. No, you have to be exposed to a person who came from China or who has been exposed to someone who came from China. Oh, we'll proceed, okay.
Sorry.
So, they are transferred, okay, the virus is transferred, okay, there's a human-to-human transmission, and this happens through respiratory droplets, okay. So, ano ba, nagsasalita ka, okay. So, yung virus pwedeng pumunta doon sa saliva mo, tapos mapunta doon sa kabila, and then you can infect someone, okay. Also, it enters via the eyes. Kaya pag nakikita nyo sila, di ba, dun sa YouTube,
Yep.
Usually you will look at what's happening in Wuhan. Di ba, they were all wearing goggles.
Yep.
Because there were also reports that says that it is transmitted through the eyes. So, also,
Which is why it's so important not to touch your eyes.
So
if you've been around a crowd of people, don't touch your eyes, don't touch your face.
So it's also transmitted through the nose, through the mouth. Kapag
Don't worry, I just have something in my throat. Something in my throat. I don't have coronavirus.
Yeah. So, pag nag-ubo-ubo sila, so it's very scary. Oh? But it's just the same as most of the viral infection. Same with measles. Measles is also transmitted through respiratory droplets, cough, cold. So, basically the same. Oh. Hindi naman, there's really nothing exceptional with this virus, except that this is a new virus that we have not known yet. So, most probably, some of the doctors there also, they do not also know how to manage. Hindi rin nila alam, kasi this is a new virus. So, we are all learning. So, we are learning with the medical community as well. So, but do not be overwhelmed, okay? So, we will teach you how to protect yourself. So, Now, it's a WHO global emergency.
Global health emergency, correct.
And what do you mean by global health emergency?
What I mean by global health emergency is this is a significant warning to countries all across the world, which is why, for example, countries like Russia have closed their borders and canceled visas across a 4,000-kilometer border with China. You know,
Mongolia as well.
They're taking this very, very seriously. Now, unfortunately, in the Philippines, it's a little different. They're still allowing flights to come in from China. You know, I'm not sure that's a really wise idea, especially since, you know, obviously there's the incubation period, and the health officials from China have repeatedly said that folks are infectious while before they're showing signs of infection.
Period.
So, you know, the thing is, you have to try and do your best to limit this. You know, unfortunately, I think as far as Phil is concerned, it's a little bit too late right now because they've allowed so many of those travelers to come in. So at this point, the best that can be done, you know, you can't limit the travel anymore. The best that can be done is for us to each take personal responsibility to look out for our own health.
Protect yourself.
Protect yourselves.
Also, the health of your community.
And your kids.
Community, or not even the community, but the health of your family members. Okay, so what are the practical tips that you can use, okay? So you can use herbs. So there are a lot of herbs. Marami pong herbs that has shown in research
and
that have
scientific research
that have an antiviral properties.
Correct.
And one of them is garlic. So
Correct.
garlic, amazing garlic. Yun lang, if you're gonna use garlic, again, if you're gonna use herbs for medicinal purposes, you have to use them 5 to 7 times higher than the normal. Okay? What is the normal? For me, ang normal sa akin ho is isang dakot. Okay? After that, isang dakot, so 5 to 7 times, you have to drink them higher. Okay? So garlic is one of the best antiviral herbs that are available out there. Ginger.
Which, by the way, real quick, garlic has been scientifically demonstrated in studies to be significantly beneficial against bacteria, as far as, you know, the viruses are concerned. So
Bacteria, virus, antifungal.
That is beyond question. Anybody that wants to argue that point, bring it.
Yes. So, garlic is one of the best antiviral. So, inumin nyo lang ho yan, kainin nyo. That's 3 times, or you can eat it as many as you can, especially if you have it, okay? Another is ginger. Ginger also has an antiviral property. Turmeric. Yan. Echinacea. Oregano, and my favorite, honey and cinnamon. So whenever my children have viral infection, especially here right now in the US because it's the flu season.
Yes.
Okay, so when you have the flu season, everyone is coughing, okay, kasi malamig. So what usually happens is that they would come from school, my children, and then they would be coughing. So the ones that I usually give them is honey and cinnamon. So these are some of the herbs that you can use to enhance your immunity as well. So they have also anti-inflammatory, immune-enhancing properties, and also antimicrobial properties. So, pwede nyo siyang gawin, okay? And again, you can use mega-dose vitamin C.
Correct. It's obviously vitamin C has been demonstrated to significantly immunomodulate your immune system. So.
Yes. So you can take it 1 teaspoon, okay? But if you're feeling sassy, you know,
go higher.
You can go higher, which is 1
It's up to you.
tablespoon once a day.
It's up to you.
The problem is you will have diarrhea. That's the side effect of the mega dose vitamin C. One of the best
Basically just, you know,
things that you
it's a
can
bowel
do.
tolerance. You know.
Yeah. So those are very simple. And another one is Boston Sea. Okay. Yan.
They see it backwards too, by the way. Mike.
So Boston Sea can also help you 1 teaspoon 3 times a day. Again, to reiterate, you can use herbs, Boston Sea, and mega dose vitamin C. Those are the things that you can use right now, or you can drink to protect yourself. But what about the practical things?
Well, some of the practical things you can do. I mean, the thing is, will it hurt you to wear a mask? No. Can it benefit you? Yes.
It provides a certain degree of protection, but it doesn't provide 100%. Okay? So even if you're wearing a mask, it doesn't provide 100% protection. Okay?
But the thing is, if you're going to be out with a lot of people, riding in a jeepney, at the mall, at the market, does it make good sense right now to wear one? Yeah, it makes
It
good
does.
sense.
Yeah.
You know, the thing is, do we have to be faced with a significant pandemic to make wise choices for ourselves? No. No. And some people don't want to be KSP and wear a mask.
Yes.
But the thing is, it just makes good sense to do it. Like she said, it offers a level of protection. It's inexpensive to do.
And also, do not go to crowded places.
Try and avoid it.
Try to avoid
avoid
going
it.
to malls, to
Yeah.
parties. And
Yeah.
if you're not feeling good,
And-
you isolate yourself.
And don't be so handsy with people for the time being,
Don't be too handsy.
Don't
Don't
be too
touch,
handsy,
don't hug,
hugging, kissing, all these different
kissing.
things.
Yeah.
Because that's obviously a significant way to spread infection, close contact.
I mean, if you have a chicken pox, okay, this is just with the chicken pox. If you have a chicken pox, okay, what is the first thing you do? You isolate yourself. Yeah, because you don't want anyone to be affected.
You're not
diba?
kissing all your
Ayaw
relatives.
mo- Yeah. So, I mean, if it was me, I have a chicken pox, I will not go to crowded places. Hindi
Correct.
ako pupunta sa mga may concert because I know that I can infect them. Okay.
When it comes to your utensils, they have to your plates, your cups, your forks, your spoons, all these things, they have to be sanitized and sanitized well. Otherwise, you have the potential of spreading
Okay.
if you do happen to get infected.
But what about the coughing etiquette? What is a coughing etiquette? Sir Jack knows this.
Coughing etiquette: if you cough into your elbow like like this. So
Do
that
not cough like
don't be like all
And
over
spit,
everything
don't
and
spit.
spitting everywhere. Seriously. The thing is, if you have to cough, don't spit on the sidewalk. Don't spit around people. Would you like that if someone did it to you? If you happen to see someone who's gacking and coughing and they spit in front of you, are you gonna like that? No, of course not. So don't do it to other people. Just be.
Yeah.
Let's have some etiquette when it comes to one another.
Be mindful. And then
Just
when
be
you're
mindful.
gonna cough, you have to cough on a tissue paper.
Preferably on tissue.
And dispose them properly. Do not dispose them
Yeah, don't throw it on the
everywhere.
ground.
Yeah, dispose them off properly. You can also put sanitation, You sanitize. Also your house. You have to sanitize your house.
Time to clean the house.
Maglinis ka.
Clean your house.
Yes. So you have to sanitize. You don't really necessarily have to use, if you don't have the money to buy some of the disinfectant, one of the best disinfectant is white vinegar. So white vinegar po, as simple as white vinegar. So put it in the surface that it's affected, because some of the virus, they can stay awake, or not awake, but they can lie
Dormant.
dormant
Without a host.
around 5 days. So 2 to 5 days, pwede po yan. So they can spread. So akala mo, okay ka na.
Yeah, so
safe ka
think
na.
about
So
it.
around 2 to 5 days. Tapos mahawakan mo
Yeah.
yung naubuhan.
So basically, Mom, someone could gack on the side of the jeepney,
Yeah.
3 days ago, and you touch it. There's obviously a potential there, a potential for transmission.
To be transmitted. So ingat. So cleanliness is very important. In
Next to
fact,
godliness.
because we were actually talking about that, diba? Even the Israelites, Jehovah told them that you have to be clean. Okay, they told all the Israelites how to dispose of their manure. So pag tumatay sila, so kailangan ganito ang gawin ninyo. You have to dig, and then you poop there, and then you have to cover it. Even they were also talking about washing. So how to properly wash the hands. So back then, so Jehovah is a good God, because He knows that some of us can infect one another. And if we live in a community, even here in the US, right, honey, in the 1800, they do not practice proper
No, we're not proper sanitation, we're
sanitation.
not proper sewer systems and
So
such.
they were just throwing their poop
On the street.
in the street. So, and then everyone is getting sick. So eventually they were able to identify what was the reason why people are getting sick back then, and that led to a lot of discoveries and a lot of procedures that they have to follow to maintain cleanliness. So, very important, maging malinis po tayo. Take a bath every day. Some of us, we don't take a bath anymore, okay? Proper hand washing, diba? So, paano ba yung proper hand washing? How do you wash your hand?
Using both hands, using
palms,
some sort of soap.
Here, 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 okay?
Clean them well.
Like this, kung mag-hand wash ho kayo, ganyan, that's how you wash your hand, okay? Not necessarily with the most sophisticated soap, just a soap and water, that's the basic soap and water, that's very
But take your time.
important.
Take your time to do it right.
Yes, okay? And of course, you have to cook food properly. Wag ho kayo kakain ng raw food. Especially Sir Jack. Sir Jack likes raw food. Do you like
Not
raw
raw,
food?
but I like my steak a little rare.
Okay, so it's not good because some of them, the virus might still be alive when you eat them. Not only virus, no? Probably it's also parasite. Some parasite and bacteria, especially with the eggs, they have salmonella. So, pag hindi nyo niluto yan, and there's a high probability that you're able to eat as well. So, it can make you sick. So very important that you have to cook your food properly. Cook them. It's your responsibility as a human being, as a person. It's your responsibility to take care of yourself and your family.
You're responsible for your health ultimately.
Lagi naman yun eh, di ba?
You make the choices. Your health is your responsibility. And you have to, you have to come to grips with that. You know, you're not a victim. The vast majority of what happens to you are your choices. You know, for example, it's well documented. In fact, you could even. It's funny. I even saw it on Wikipedia yesterday. It's something you've been saying for years that only 5 to maybe 10% maximum when it comes to cancers are genetic, and the other 90 to 95% are related to environment. Our lifestyle, our choices, the environment we live in. And what's funny is, again, I saw it on Wikipedia of all places. They're now even quoting that. So it's nice to see you once again validated, Mom.
Okay. So now, next is you have to eat nutritious food. So kumain ho kayo ng mga pagkain na that is proven to enhance your immune system. Because you are what you eat and what you absorb. Okay? So that's really the rule in all the eating. So kung kumakain ho kayo ng pagkain na junk foods, di ba? How can it enhance your immunity? So how can it protect you? So you have to eat foods that are rich in proteins. Yeah, kain po kayo ng itlog. Yan. You can also eat mushroom. Yeah, that's my favorite. Mushroom, lentils. Yan. So these are proteins. And also meat. Okay, mas maganda is organic meat. Yeah, that's the best. You can also eat foods that are rich in vitamin C again. So chili, sile. Yan, lalo na ako, mahilig ako sa sile. Yeah, Sir Jack, I just because I'm pregnant, so I'm trying to
isn't that awesome?
I'm trying to eat a lot of sili right now. Nagkakaroon po ako ng cravings with the sili. And sili has a high vitamin C content, di ba? So one of the best things that you can take in pagka meron ho kayong problems. Also with garlic, onions, yan. So basil, thyme, all of these herbs, they can actually help you to enhance your immune system. Yan. Tea, yan. Kung mahilig po kayo sa tea, so the teas can help you also. My favorite tea is black tea. Also, green tea as well. So, yung mga yan. Meron po mga properties that it can help you. Mga gulay, of course, diba? So, alam na natin yan. And then, exercise. So, if you exercise, you increase your lymphatic system. So, your lymphatic flow is better if you exercise. So, do not forget to exercise as well. These small things, you think they are insignificant, but they really have a big impact on our body. So, yeah, these are the most important thing. And again, I want to reiterate about cleanliness.
Correct.
Yan. So, maligo kayo. Because some of them, they don't take a bath. So here you have to take a bath, okay?
Yeah, I mean,
cleanliness.
Go through the steps again, very briefly again, Mom. Some of the things that people can do to prevent, potential infection, help prevent it.
Okay. So again, to summarize, so you can use herbs. Okay, these are garlic, ginger, turmeric, oregano, honey, and lemon. They have antiviral properties. Megadose vitamin C, Boston C. Some practical tips is, if you're sick, you isolate yourself. Do not go on crowded areas. malls, parties, etc., you have to wear a mask. Now, I'm seeing people here commenting, what is the best type of mask? They're saying there's one who says it's N95 or something. Okay. Okay. This is I do not advocate any mask, okay?
Any brand, any particular type.
Yeah, but
it's whatever you can get. Any one that you get is going to offer you some degree of protection.
No, just a plain cloth or handkerchief. They're okay. Okay, just do like this, okay? So
I can't hear you. She said just do like this.
So the plain handkerchief, that's already okay. So I'm not gonna say what type of mask, okay? Just make sure that it's properly covered. The nose, the most important is the nose, the mouth, and the eyes. They're properly covered. Because I told you there are some research that says that the virus can also go inside the mouth, the eyes. So very important. And you have to wash your hands.
Well,
again,
wash them well.
using soap and water. Do not kiss, hug, or anything that is hug, kiss anyone who is sick.
If you're out in
And
public,
you have-
avoid touching your eyes and face.
So you have coughing etiquette. So how do you cough? Again, you cough. How, Sir Jack?
Like this, or into a tissue.
You have to eat nutritious food, and you have to cook your food properly. So relax, don't panic.
Relax, don't panic.
So those are the things, and I hope that you enjoyed our discussion again of the novel coronavirus.